Welcome to La Verdad Duele. What is that? The truth. The truth that hurts. Even though we're not intending to hurt anybody's feelings, we know that we may share information that many people have strong opinions on. This is solely based on the fact that we love sharing information and we love passing down knowledge. And this podcast is all about that. And we hope you can enjoy that. Let's get to it. I had to record something real quick, and I hope that this will be informative to the people that are in our communities, and especially the Fairfax County area and the Falls Church, Fairfax County areas, including Falls Church and Falls Church City. And I'm your host, Tijani Musa. And this new virus, a release from the Fairfax County Health Department Workplace Guidance, this new virus in Central China in December 2019. And the Fairfax County Health Department stated that testing of the virus suggests that it originated in bats and was transmitted to humans from an intermediate animal host. And the COVID-19, like many other respiratory viruses, spreads between people by respiratory droplets that are expelled with coughing or sneezing. It also likely spreads when someone touches a contaminated surface and then touches their mouth, nose, or eyes. And so that's why they said not to avoid touching your face, your nose, or your eyes all the time. And they want you to minimize the exposure. CDC suggests that the risk of infection being transmitted by respiratory droplets increases given contact with a patient within 6 feet for more than 10 to 15 minutes. COVID-19 does not remain suspended in the air, as does measles or tuberculosis, and does not travel through ventilation systems. So that's not something you should worry about. Both social distancing and physical barriers are effective methods of prevention. And so that's why they encouraging people to stay away from large gatherings like the mall, places of worship, unfortunately, stores, just anywhere that there are gathering, movie theaters. Just try to avoid those areas for now. The symptoms of COVID-19 disease include fever, a dry cough, and difficulty breathing. Muscle aches and fatigue is also another symptom. Sore throat, diarrhea, and vomiting are uncommon. So if you are experiencing those, even though they are uncommon, it is also a good practice to probably seek medical attention. The incubation period of disease, the period between when one acquires the infection and when symptoms of illness begin, ranges between 2 to 14 days. And that's why you hear a lot of people talking about quarantine for up to 2 weeks. And of those who become ill, about 1 in 7, about 15% develop severe illness, such as pneumonia, and require hospitalization. And about 1 in 50, about 2% will die. So even though that number is very small, it is still a very high risk virus. And so get medical help immediately when you suspect anything. And this fatality rate or fatality ratio is similar to that of the 1918 influenza pandemic, the most severe in modern history, and is much higher than the 2009 influenza pandemic. And so overall, people should be mindful and should be aware. The high risk groups for COVID-19 are what is already being talked about, older people and also kids. What we know so far, older adults and persons with underlying illnesses and compromised immune systems are most likely to get severe infection and to die from the virus. Children seem to be less likely to be infected and their disease is usually mild. But in all regards, you should still protect the kids as well as protecting the older adults in our communities. While COVID-19 is not currently circulating in all areas of the country, we still have to be mindful of our interactions with other people, because when you're protecting yourself, you're also protecting your neighbor, you're also protecting the people you care about. And so some of the basic things that we hear already is staying home if you're sick and keeping away from others as much as possible. If you have symptoms of fever and cough, stay home until at least 24 hours and just monitor it and see how that come about. And if it persists, then you should get medical care. Hand washing, even though it's as basic as it sounds, things that you probably have heard of in elementary school or even before that, is something that is very effective. So washing your hands with soap and water, warm water preferably, or lukewarm water or something, or if you can stand the temperature, you could use hot water as well to wash your hands. COVID-19 may spread via contaminated hands or inanimate objects that become contaminated with the virus. Wash your hands frequently for about 20 seconds. I've tried this myself. 20 seconds is pretty much singing the happy birthday song twice, like depending on how long your name is, obviously. So I tried it, and when I was washing my hands, I sing the happy birthday song. Happy birthday to you. Happy birthday to you. Happy birthday, dear T. Johnny. Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday, dear T. Johnny. Happy birthday to you. So that takes about 22 seconds. So depending on your name, or you can just use a short name like Joe, you still get to 22 seconds or at least 20 seconds. And so that is what they are asking you to do. Just wash your hands thoroughly, dig into your fingernails and try to wash them as properly as possible. Hand washing with soap and water is the most effective way to remove dirt and germs from your hands. The act of running water down your hands while scrubbing them together is the most important aspect of hand washing because it eliminates germs. The temperature of the water should be warm enough to allow one to place one's hands fully and comfortably under the water stream and is not the primary factor that eliminates germs from your hands. Alcohol-based hand sanitizers can also be effective if soap and water are not available. So always go with the water and soap. And so that's why I didn't understand why every store in America is out of hand sanitizer. It's like the primary go-to for people, but the most effective one is actually soap and water. So use that when you can. When you have access to it, try to wash your hands very regularly using soap and water. And so respiratory etiquette, cover your nose and mouth with a tissue when you cough or sneeze. Throw the tissue in the trash after you use it. So just basic things, protecting yourself as well as protecting your neighbors. The coronavirus are thought to spread mainly from person to person in respiratory droplets, from coughs and sneezes and sneezes. And if a tissue is not immediately available, coughing or sneezing in one's arm or sleeve is recommended. And so people should be mindful of that and understanding where they are. And keeping from touching your mouth, nose, or eyes, you can become infected from the virus that is on your hands when you touch your nose, your mouth, or your eyes. Keeping your hands away from those sites and washing them regularly or frequently will protect you from infection if you touch a contaminated surface. So make sure that you're mindful of the places you go or the places you touch. Viruses like the COVID-19 are primarily spread by respiratory droplets, like we already talked about. And so just be mindful, protect yourself and protect your neighbors, and look out for the older people in our community and the younger people in our community and in our society. And Fairfax County has a few resources for people living in the county. To get information on employees of the county can go to the fairfaxcounty.gov/health/novel-coronavirus. And you can get information on that. For information on individual and family preparedness, it's available at the Ready Fairfax website, which is fairfaxcounty.gov/emergency/Ready Fairfax. So you can find information on that, and information on the COVID-19 situation in the U.S. and guidance for specific audiences such as law enforcement, EMS, and schools is available on the CDC website, which is www.cdc.gov/coronavirus/2020-NCOV. And so you can find out information from these websites. And information on COVID-19 situation in Virginia is available at the Virginia Department of Health website at www.vdh.virginia.gov/surveillance-and-investigation/novel-coronavirus. And you can find out information on that. And simply just Googling this information, it'll come up. And so I also want to share some resources very specific to Fairfax County. So when you go to the Fairfax County website, because we all know that most of the people that are affected in this virus are the people in our communities that don't have enough. So low-income families, minorities are going to be affected the most. People that work 2 to 3 jobs to make ends meet. And some of these people they don't have the health insurance. They don't have the protection from their employees, from their employers. And so they are the one that are going to be affected the most, and they are the one that are going to suffer the most. In Fairfax County, we have many students that are on free and reduced lunch, and they are going to school. And for most of these kids, some of them, the only meals that they have from when they wake up to about lunchtime is the meal that they get from the school. And so if the schools are closed, it is a huge problem for them. So now the chances of them actually having something to eat becomes really, really low. And so the parents of these kids, and it brings a lot of stress into the household for the parent and as well as the kids. And the parents that had to work 2 to 3 jobs now can't go to work because the working place or their working environment is closed due to the virus, and they're not getting the protection from the employers for like supplemental income. And so this is affecting a lot of people. It's one thing, the coronavirus affecting people, but it's also the consequences that happen because of the coronavirus. And those consequences sometimes are even more dangerous than the coronavirus itself, because for the most part, most people are not going to get the virus, but the effects of the virus affects almost everybody, especially those people in our communities that are fighting to make things happen for themselves and for their kids. And so for those people, they can go to the fairfaxcounty.gov/HSRG, which I believe is the human human services page. And when you go to that website, again, the website is www.fairfaxcounty.gov//HSRG. And when you get to that website, you see different buttons on the page. On the home page, there is a button that says food. There's a button for housing. There's a button for financial assistance. There's a button for medical and health and dental. There's a button for domestic violence prevention, there's a button for shelter, there's a button for employment, for clothing and housing, transportation, and for veterans. And so when you go to that, for those people that are going to be struggling for food and clothing in the next couple of weeks, I suggest going to that website and clicking on food, and then you can even search it based on your city and also based on your zip code. And you can also enter the type of service that you're looking for. And so when you go on that website, you'll be able to find out more information about the services that are available to you in the county. And for, like I mentioned, for the people that are in Falls Church area, I was able to go on the website and saw a few nonprofit organizations that are providing assistance to people in need. And one of them is in Columbia. It's called the Columbia Center for Missions. And this is in Falls Church, Virginia. The zip code for that is 22041. And the organization, the primary services provided are food pantry and legal support and guidance. And you can reach this organization through their phone number of 703-534-5700. And this organization is located at 3245 Glen Carlin Road in Falls Church. And that's a nonprofit that is available to help people maintain some kind of stability in their home by providing them non-perishable food that is distributed to individuals and families in need. And another organization that also provides social services to the community is the Al-Hijra Islamic Center. It's situated right on Route 7 at 3159 Rose Street, Falls Church. And the Al-Hijra Islamic Center can be reached via 703-531-2905. And that's their phone number. You'll be able to speak to somebody that can direct you to the right place. And another nonprofit that's also providing emergency food is the Falls Church Community Service Council. And the Falls Church Community Service Council provides emergency services such as clothing, furniture, household goods, food and financial assistance for housing, utilities, prescription, and other emergency service needs. And this nonprofit is located at 7416 Arlington Boulevard, Falls Church. And you can pretty much reach them via their phone number of 703-222-0880. 703-222-0880. And that nonprofit provides emergency food, perishable and non-perishable, to individuals and families in need. And then they also provide coordinated services planning essentials for people as well. And then another nonprofit is the St. Anthony's Catholic Church. St. Anthony's Catholic Church is another nonprofit that's also providing assistance to individuals through perishable and non-perishable emergency food to individuals and families in need. And they only advise that people in need can pick up these things from their site. And you can reach them at 703-820-2011. 703-820-2011. That is a good a good organization as well. And another one is the Como United Methodist Church. It's also in Falls Church, Virginia, and you can go and see them at 3400 Charles Street, Falls Church, Virginia. And you can reach them via their phone number of 703-821-5131. 703-821-5131. And this organization right here offers fresh seasonal produce for pickup one time per month. Availability of vegetables and fruits varies each month. And like I said, you can go to the county website and you will find a lot more resources available to you. And make sure that if you know of these resources that I just mentioned in here, you can share them with people in your community, people that need them. And if they can't access the website for any other reason, just be of resource to them. Call the number for them and make sure that your neighbors are taken care of. Because when your neighbors are taken care of, you indirectly also benefit from it. When your neighbors are well, you are also well. So let's let's unite together in this pandemic. Let's unite together in this pandemic, and let's take care of our neighbors, as well as we're taking care of ourselves and the people we care about. And so there are a bunch of nonprofit organizations in the county that are very helpful, that are very useful, and you can reach out to them, and you can ask them for the help that you need to protect yourself and protect your family. And so that is the reason why I wanted to record this posting real quick and provide those resources for people in our communities, because it is very, very important and is very, very imperative that we're looking out for one another. And so another phone number that you can call for the resources that I just mentioned is called CSP, which is the Coordinated Services Planning. It's also through Fairfax County. The CSP phone number is 703-222-0880, 703-222-0880. CSP is the central locations where you can call them and tell them that you're looking for food, you're looking for shelter, you're looking for clothing. They will be able to direct you to the nonprofit or to an organization that is closer to you. And so they have the most readily available information to assist you. And the last thing that I want to talk about is what the Fairfax County Public Schools closure meant to the community. And Fairfax County closed schools today. Today is March 13, 2020. March 13, 2020, and Fairfax County closed schools. And because of that, Fairfax County has what they call grab and go lunches would be served at the following sites today at 11:30 a.m. And that is in responding to the need that I just mentioned earlier, that some of the people, the kids in the community, survive on the lunches that the school provides. And so if the schools are closed, it is a problem for these kids at home. And so because of that, Fairfax County put together resources to provide lunches and meals to the school. It's called the Grab and Go lunches that started at 11:30 a.m. this Friday. And some of the sites are the Bailey's Elementary School, which is at 611 Norwood Drive, Falls Church. The Hutchinson Elementary School, located at 13209 Parcher Avenue, Herndon, and then Hybler Valley Elementary School at 3415 Lockheed Boulevard, Alexandria, and then Loudon Town Elementary School at 6100 Stone Road, Centerville. Then Burke Center at 9645 Burke Lake Road, Burke, in Virginia. All meals are prepared and packaged in styrofoam coolers with Cool-It sheets. And so they are well bagged. Meals are placed in a box prior to giving it to you. All meals are available at no cost to the kids 18 years and under. So school age kids 18 years and under get the meals for free. And adults' lunches are also available for purchases. I'm pretty sure the county has a sliding fee. If you go in there and you said to them you cannot afford to purchase that food at the regular price, the county would work with you. They are not going to turn you away. I guarantee you that. And so take care of yourself. Look out for the older adults in our communities, and let's all be a united front in this pandemic, and that's the only way we are going to be able to survive it. And so I hope that you enjoy this quick recording It's one of my longest recording because I'm talking about resources for the community. And so I hope you enjoy it. You can reach me at truelaverdaduele@gmail.com. That is truelaverdaduele@gmail.com. If you have any comments, any feedback, any ideas, any things that you want me to talk about, you can please write them down on this comment box, and I'll be able to do my best to discuss those things in the future. But for right now, we are focusing on helping our community survive this terrible virus. So thank you for listening. Have a great year. 2020 is just beginning. Don't be negative about it. Be optimistic. Be positive. It's going to be a great year. Thank you, and I wish you a 2020 vision.